Right. Hello, everyone, and welcome to our health science session. This is the part of OC Career Week 2021. So thank you all for joining us today. We have some fabulous employers with us today, ready to talk about what opportunities they have to offer. And so I'd like to welcome all of the students that are joining us today, and also hello to all the students that will be watching this later. My name is Mireya Jacuinde. I serve as the lead academic success coach for the School of Business and Industry, and we're happy to present you guys with these, connect you guys to these amazing employers that have a lot of information to provide today. So we're just going to do it panel style. We're going to have a few employers present, and then at the end, we'll have some time for some question and answers. A few household items: make sure that your mics are muted so that we can hear the presenters as they are speaking. For the students joining us today, the DTS code is 6280. So if you're a student of ours, go ahead and put that DTS code so you can, so that we know that you're here today. And if you can, also put your student ID number in the chat. We will be doing away some giveaways today, so we want to make sure that we know who you are. So please put your student ID numbers in the chat. Without further ado, we'll go ahead and get started with our amazing panelists. Up first, we have a representative from Ward Memorial Hospital. Please join me in welcoming Vanessa Alanis.
Hi, Mireya. Thank you so much for the invitation here. We are glad to be here. Hello and good afternoon, everybody. I am Vanessa Alanis, and I am HR Administrative Assistant here at Ward Memorial Hospital, a lovely little hospital here in our small community of Monahans, Texas. So we have a lot of different departments available here. Nursing, of course, is a large part of like what the hospital is. We have radiology, we have our emergency room, we have surgery, we have our two rural clinics, we have physical therapy, respiratory therapy, pharmacy. Again, for nursing, we're always accepting applications for LVNs, RNs, PRNs full-time. I don't think in nursing right now we currently have any open positions, but again, we're always accepting applications. We'll keep your applications here for up to a year. The way that application process happens is you'll submit your application, and on the chat, I put on there our website information, wardmemorial.com, and what you'll do is you'll navigate over to the careers tab where it shows all the available positions we have. I think currently right now we have an open position for a physical therapist assistant. It is a full-time position. Again, the application process, you can submit your resume to my email, vialanis@wardmemorial.com, or also visit our website and submit your application through there. So I will receive your application, and what happens is we send it on to higher administration, and they review it. So it's important when you submit your resume, your applications, we do want you to keep it simple. We don't need any elaborate resumes on your application. Be sure that it's all completed correctly. A lot of the times we'll receive applications where there's a section of the nature of duties, if you have any previous experience for anything. Be sure that section is filled out, because like I said, we'll receive more than one applicant for every position we get, and that's looking at how you fill it out, experience, any school experience or anything, is how we'll weed out to see those candidates that are qualified for the positions that we are looking for. So go ahead and visit over, like I said, what happens then after, once we select those candidates we believe qualify for the positions we're wanting to fill, we'll send them over to our department managers. So the department managers are the hiring managers, are the ones, we'll call in the candidate, they'll set up an interview, and we'll offer position if we see that we want to bring that person in. Benefits that we offer, we have a lot of great benefits. We have PTO, paid time off. We have our holiday PTO, which is a separate bank for that. We have extended illness bank. We have our retirement, which is TCDRS, which is a Texas County and District retirement system that we go through. We have insurance and life insurance, paid life insurance if you're participating with that health program that we have. Like I said, you can visit our website to review any openings we have, read through the description. If you're interested, go ahead and contact me. Again, the contact information is here on the chat. Any questions you may have, you can always email me, visit our website, like us on Facebook. We also have an account on Instagram where you can follow us and we'll have stuff. We have an employee activities committee that we started this year. So what that committee does is we meet at least once a month, and we've started to do fundraisers where we'll raise money just to have different employee activities, for employee appreciation. So a lot of fun things, and we can't wait to have you all out here and join us. Thank you.
Thank you so much, Vanessa, all the way from Monahans. Awesome. Glad we have that representation. Okay, so next we have a representative from Thrive Skilled Pediatric Care. So I'd like to pass it on to Jamie Weingart.
Hi, can you guys hear me okay? Okay, great. I'm also here. My name is Jamie. I'm location director, and then I also have Lacey, my clinical director, on as well. So I actually had a PowerPoint. So do I have the ability just to take over, or? Okay, let me see here. Do you guys see this PowerPoint?
Not yet. I
No.
think you have to share your screen.
Yes, I did. Let me see here. Okay, there we go. Okay, how about now? Can you guys see that?
Yes, ma'am.
Okay, great. I will go ahead and get started. Like I said, we are with Thrive Skilled Pediatric Care. So we are a pediatric home health company. We hire LVNs and RNs. We do service patients age birth to 21. So we have babies right out of the NICU all the way up to even kiddos that go to school. So we do hire nurses that are in the home with the patient. They can go to school with them, lots of different options there. So I have a lot of slides, but I'm not going to go through all of them. So I'm going to skip over a couple. A little bit about our history. We were founded in 2016 to improve the quality of life of children with medical complexities and ease the burden on the families. We are one of the leading pediatric home healthcare companies in the nation. We do have about 30 locations nationwide, and I am located in Lubbock, but from my Lubbock office, I do go 3 hours every direction. So we have patients in Midland, Odessa, Pecos, Kermit, Fort Stockton, Monahans, Rankin, everywhere. So we have a lot of patients out that direction. Here at Thrive, our purpose is to provide high quality clinical home care to medically fragile children so they can grow and flourish to their full potential. We do have 5 core values here at Thrive. Those are excellence, respect, integrity, compassion, and social responsibility. We do have several strategic goals here at Thrive, and one of those is to focus on clinical excellence. We want to ensure we provide high quality clinical home care, and we pride ourselves in our low hospital admission numbers, preventable ER visits, all of those things we're really proud of. Our patients are very stable with the nurses that we have in the home. And here we have more of our strategic goals. So we do conduct clinical supervisor visits every 30 days. We do always have an RN as well as an administrative person on call 24 hours a day, also weekends. So if a nurse ever needs to reach out or has questions, anything like that, maybe they're working night shift, we do have nurses that are available to help them immediately. We have a lot of different training programs for vent and trach classes, different skills, central lines, things like that. We're always willing to train. And we're really big on promoting from within. So we have a lot of nurses that started out in the field and they have since been promoted to administrative positions in the offices. So it's really a great company. Different services we provide. Our main one is the private duty nursing, like I talked about. So that's going to be where the nurse is in the home from about 8 to 12 hours a day. We also do the skilled nursing visits. We have a few of those patients in Midland, Odessa. And then therapy we offer only out of the Lubbock office. So that one would not apply to this area. We do take all insurances, Medicaid and commercial. And I'm going to let Lacey take over. We're getting kind of into the more clinical stuff.
Hey, I'm Lacey. I'm with Thrive. Sorry, my video is completely messed up. But so we service kiddos that have trach and vent. We service kiddos that have G buttons. We do seizure management. It's a pretty big one for most of our kiddos. We also have medication administration, whether it's via G button or whether it's through a PICC line or a central line. We also, of course, do lots of education with the families and anybody involved with their care to make sure that they're proficient in that. We typically start new grad LVNs out at $18 per hour and RNs at $27 per hour for the day shifts. And we have cases open currently in Andrews, Denver City, Lubbock, Midland, Odessa, Fort Stockton, Pecos, and some more. So of course, if y'all are in those areas, of course, call us and let us know. And here's some information to reach out to us if y'all are interested. And like I said, it's a good place to work your way up, and there's always opportunities for growth here. And it's really good and flexible with schedules going back to school, things like that. So we are always open to whatever position you could fill, whether it be PRN, part-time, full-time.
Yes, that's right. That's pretty much all that I have on the slide. So like she said, we always are hiring PRN to full-time, LVN to both RN. So here's my contact information. I also put it in the sidebar. So if anybody has questions, feel free to reach out.
Thank you so much, ladies. That was awesome. Again, if for the students that are watching, if y'all have any questions for any of these employers, feel free to ask them in the chat and we can address those at the end. I do want to give all our presenters enough time to present. So for your questions, we'll save those all until the end. Next, we have a representative from Texas Tech Health Science Center, Family Medicine. So I will pass it on to Mr. Bill Arencibia.
Yes, thank you. Thank you for having us, Maria. My name is Bill Arencibia. I'm with Texas Tech Health Science Center. I am the unit manager for family medicine clinics in both the Midland and Odessa area. We do have job opportunities available for CNAs, MAs, and also LVNs. We do have a couple of opportunities coming up. We have a clinical assistant position open now in the Midland area. At the end of May or in the middle of June sometime, we'll probably have an LVN position open as well. We do have a great benefit program. Oh, and let me tell you about our work schedule. This is one of our great benefits, is our work schedule is Monday through Friday, 8 to about 5:30, 6 o'clock. No weekends. So your weekends are always available for your family and friends if you need to have that available for you. We also have in our benefit program health insurance. Your health insurance is completely paid for, so it's no cost to you. You can add your spouse and your children for extra costs, but for you yourself, it's paid for completely. We also have 11 paid holidays, Christmas, Thanksgiving. You're off on those particular holidays every year. And once in a while, we even get a snow day. If the roads are too bad, then they will actually close the clinics, and when you can stay at home with your family and enjoy the snow or the weather. Right now, we currently are doing a COVID vaccines. We have the Moderna vaccines that we're offering every Wednesday from 12 to 5. It's absolutely free. You just come in if you haven't had your shot, and this is open to the public, so just give me a call. I left it in the sidebar, and we'll get you scheduled and set up to come in and get that free vaccine. You'll get both shots, so this will be the first of the 2 series. And that's pretty much it for me. Thank you, Maria.
Thanks, Bill. Thank you for that information. And I'm glad you mentioned the vaccines, because I know that in this area, there's a lot of people that still need to get it and want to get it. And so thank you for giving us that information.
Sure, absolutely.
All right, so we're going to go ahead and go to our next presenter, who is a representative from Medical Center Hospital. So I'd like to now pass it on to Mrs. Haley Beninen.
Thank you. Hello, everyone. My name is Haley Benyon. I'm a recruiter here at Medical Center, and I have Gabby with me today. She helps run multiple of our intern programs across the board. I'm going to share my screen with y'all. Okay, let me know if you guys can see that. Are we good? Okay, so like you all may be aware, Medical Center, we are the number 2 employer in Ector County. So you can see when you break down by industry, about 30% of employment within Ector County is healthcare. So we are making up a huge portion of the economics and employment here in Ector County. Just a little bit about our hospital. You can see the timeline here, but we started open back in 1949 with only 85 beds. So in that top left, you can see that is the original hospital. And then you can kind of see the timeline of some pretty big years where we added multiple towers and how we've grown. We are now a 403 bed hospital, and we are a health system. So multiple clinics, urgent cares, things like that. So that creates lots of job opportunities for you all. Just to break down kind of the main hospital, we have 7 inpatient units or multiple floors. So you can see kind of the breakdown of those different floors and kind of what they entail. All of these inpatient units have opportunities for employment from RNs, LVNs. We have patient care technicians or assistants. You don't need any credentials for that. We also have CNA opportunities, and then we have anything from patient transport, where you're moving patients back and forth, as well as radiology or rad techs. In multiple areas, as well as MAs, lab, anything you can really think of. We also have a pretty large emergency department. We are a level 3 trauma center, so our ER is compiled of 30 beds and 6 fast track bays. So opportunities, RN, LVN, like I said, techs, and also paramedics as well. We also have 2 critical care areas, 40 beds total, similar opportunities to what I discussed before. We also have opportunities for unit clerks. And so they're kind of helping manage the unit, especially in ICU and a couple of the floors, they're looking for modified night hours. So those hours that kind of look like after school, 5 to 11 or midnight. So there's opportunities kind of all hours for those unit clerk positions as well. We are a level 3 designation for our L&D, postpartum, and NICU. And so this is one of the newer parts of the hospital. It's absolutely beautiful, but we have opportunities here. Same thing, transport, techs, nurses, LVNs, really anything you can think of. And then as well as our operating rooms or our ORs. So we have 11 main ORs, 4 outpatient surgery ORs, and 4 cath labs. So lots of opportunities for jobs in any area that you may want. I've already kind of talked about some of these. If there's something that you feel like I didn't cover or a certain area that you're really curious in, I'm always open for you to call or text me, say, hey, this is kind of what I'm looking for. This is what I'm good at, and we can definitely find a place for you. Like I mentioned before, we are a 403 bed hospital. We service 17 counties. I think that equates to about 75,000 square miles, an incredibly large area of Texas. So that creates a lot of teamwork with our smaller community hospitals, as well as bringing in some pretty sick patients. So you get a lot of experience. You get to see a lot of procedures, a lot of care. We also have a partnership with Texas Tech residencies, family practice, as well as internal medicine and OB-GYN. And so that creates an opportunity to work really closely with those resident physicians and helping learn together. This is something I did want to touch on. I'll let Gabby kind of talk to this. This would be for our people looking to head into nursing school for first and second semester. We offer an internship. So I'll just let her briefly talk about the intern program.
So our internship, this is Nurse Intern 1. So this is if you've been accepted into a nursing program, you would apply for this position. So this is more of getting your foot in the door. You would be functioning as a support staff, kind of patient care tech. So skills would be kind of nursing assistant duty, so vital signs, bed baths, activities of daily living. You would be working in all areas throughout the hospital. So our med-surg areas, ER, maternal child. So you would work through that first and second, and then we have a second part to our internship. So after second semester, you would be considered an intern 2, where you would be paired with a nurse and be working more on those nursing skills. So it's kind of a process of working through first through 4th semester, and then hopefully you joining us as a registered nurse after you graduate.
Yeah, so an awesome opportunity for those that have already been accepted or looking to apply to get accepted into the nursing program. We also offer internships through our radiology program as well. So if you're in radiology or going to rad tech, we offer internships. Looks very similar to this, very flexible schedules to get you in and kind of add on to your training as you're in school, as well as radiology. So we have a cath lab rad tech, we have radiology intern programs, and there's one other I forgot. Oh, and a respiratory therapy. So I know y'all don't have a respiratory therapy program, but if that's something you're possibly thinking of, we also offer that. We offer tuition reimbursement. So why I'm mentioning this is if you're looking to go into, a healthcare profession, we have so many opportunities for you to come and be a patient care assistant or a tech here at the hospital, and we will reimburse your tuition, $5,000 a year up to $15,000. So that's anything for LVNs, RNs, bachelors, masters, anything you can really think of. We will reimburse up to that amount. And then once you have graduated and you sign on with us, we will do student loan repayment up to $3,600. So this helps when you're thinking about kind of your career path and what you're looking for. We want you to grow, get your foot in the door, and help you kind of as you navigate your way through school and make it a little bit easier. This is my contact information. I also put it in the chat box. And so if you guys have any questions, please, please, please reach out to me. I have my office as well as my cell phone. I know a lot of people prefer text. So if you want to text any questions or a specific job opening that you're looking at, I would love to help you.
All right, thank you. Thank you so much. That was awesome information. And thank you to all our presenters that presented today. I do want to allocate some time for some Q&A. So if you all don't mind sticking around just for a few more minutes to see if our students have any questions. For our students that are watching us now, one more time, if you have not entered your DTS code, please be sure to enter that now. That number is 6280. And it looks like we have a question that came in. This question is for Jamie. Does Thrive have any open positions for the Odessa locations?
Yes, Midland, Odessa. I can also list that out because we serve such a big radius, but yes, we do have full-time and PRN.
Awesome, thank you. I know that you all mentioned information about tuition reimbursements. Do any of the other employment opportunities have those types of?
Ward Memorial does offer some tuition reimbursement. It's also like a small process. It's something we implemented a few months ago, I believe. Off the top of my head, I can't remember to the amount, but it's an application and it goes through HR, our CNO, and our administrator to see, if they meet the requirements, but we do offer it as well.
Awesome. Thank you so much. Let me see if we have any more other questions that come in. Oh, and for the students that are watching, we did post everyone's contact information in the chat. So that way you guys can, before you leave, take a screenshot or jot it down for your reference later. So is there any advice that you all would give to health science students or just students considering a career in nursing or just in the health industry in general? If you all could just give some advice to our current students or graduating students. Not all at once, though. Not all at once.
I'll just say, this is Lacey with Thrive. I'll say just find your passion, and if nursing's where your heart's at, definitely go for it and strive to be the best nurse that you can be. It's a very rewarding career, and I mean, there's just so much good to it, but it's something that you have to make sure that your heart's in and be dedicated.
I think one thing that's helpful is getting your foot in the door. So there's lots of kind of step down nursing positions. So that looks like techs or CNAs, and kind of getting your feet wet and seeing nursing from that standpoint to see if that's something that you're passionate about. The tech and CNA jobs are incredibly difficult and taxing. And if you find that enjoyable, it's a good way to know that you will do fine in nursing and that you are really passionate about kind of caring for others. So I think that that's a good way to kind of see if that's where you want to move your career. But there are plenty of amazing nurses that do never get that experience up front and are super amazing. So if it's something that you think you're passionate about, just go for it. Like anything, the sooner you get your foot in the door and start networking, like any job, the chances increase that you'll be able to get into an area that you want sooner. So.
All right, everyone. Well, our session is going to get cut a little short, but that's okay. We had a lot of awesome information that was provided today. And so I thank all of the students that were in attendance today, as well as our awesome panelists that made some time to come talk to you all about all these great opportunities. So we thank you all for joining us today. We have a session for the School of Business and Industry later this afternoon. So if you're interested in joining us there, that one will be from 3 to 4 today. So with that, I will leave you all to have a great rest of your day. Thank you all once again for joining us today. Awesome, awesome opportunity for students. So we really appreciate you guys providing us this information. All right, thank you all.
Thank you for having us.
Thank you. Bye.
Bye.